A new report from the CDC shows that the smoking rate among adults was 16.8% last year, down from 20.9% in 2005. This is about a 20% decrease over a 9-year period. This is the lowest ever recorded smoking rate since the Center for Disease Control and Prevention started tracking cigarette smoking rates. People who do smoke are also smoking less. The average number of cigarettes smoked daily dropped from 16.7 in 2005 to 13.8 in 2014. So those who are smoking fewer cigarettes. Which groups saw the most significant decreases in smoking rate? Well, maybe not surprisingly, adults 18 to 24 saw the largest decrease in cigarette consumption. A number of reasons for this. Many campuses have banned all forms of tobacco. When you have fewer parents smoking, you are going to have fewer children smoking. That also follows logically. Why else does the CDC think this is happening? Anti-smoking media campaigns, new laws, and accessible quitting smoking solutions. And partially, it is because of some of the new alternatives to smoking methods. E-cigarettes, for example, did not count as smoking cigarettes in this study. So to some extent, that is also a factor. Who is having the hardest time quitting smoking? The poor, including those on Medicaid. They have a smoking rate that is almost 75% higher than the national average. And if you look at those earning $19,790, the federal poverty level, over a quarter smoke, which is about 55% higher than the national average. There have been some thoughts, Lewis, of banning smoking at all public housing in various states. It would definitely have an impact. It would definitely target one of the groups that smokes the most and can also least afford to waste money on cigarettes. But is that a nanny state? Is that similar to saying, hey, food stamps, you can't get crab, you can't get fish, you shouldn't be buying condiments, et cetera, et cetera. Where is the line?
Yeah, you tell me. Ask your local representative. I don't know. But, of course, when I've said this before, when I was in Texas, I worked on 6th Street. Big homeless population over there.
Yep.
And I do not think I met one that did not smoke.
Interesting. Now, they may not have been buying their own cigarettes. We don't know.
No. Very, very rarely.
Yeah. I do wonder if this is just going to be a thing of the past. I mean, in 10 years, in 15, 20, 25 years, will smoking cigarettes be a thing of the past? It's certainly less prevalent in the U.S. than it is in many other countries. Eastern Europe smokes a lot. Whenever I go to Argentina, it still seems like the smoking rate there is higher, although I don't know specifically what it is. It would be great to think that this could just be completely eliminated.
Yes, and I think it could happen here, definitely. But in other parts of the world, Eastern Europe, I mean, even Western Europe, Israel, so much cigarette smoking. And these companies, these big companies are targeting children in so many countries, in Asia. But it's crazy, Dave. It's crazy that this stuff exists this day and age.
During tomorrow's audience questions, we're going to discuss a question about whether you could be with someone who has very different political or religious views than you. Could you be, Lewis, with someone who smokes cigarettes?
Well, I have, and it's not easy. And maybe that's part of the reason why it didn't work out. But
You think that?
Well, I mean, someone who smokes cigarettes just has a completely different take on life and the world than me. I mean, right?
So it's not necessarily just because of the cigarette smoking itself, but you're saying someone who regularly smokes cigarettes may have other areas of a lack of shared values or priorities, whether it comes to health or whatever else.
I think so. Yeah, it's a completely different state of mind.
Fascinating. All right, let's take a break. That's tomorrow on Audience Questions. We still have more to discuss today, including a supposed picture of the type of bomb that may have allegedly, possibly taken down that Russian Metrojet plane. That's after the break.